Welcome to the Epilepsy Monitoring Unit, or as most people call it, the EMU, at UT Southwestern's William P. Clements University Hospital on the 8th floor of the Orange Tower. This video will prepare you on what to expect during your stay in the EMU. You will be asked to arrive at the hospital at 7 a.m. on the day of your scheduled admission. Please make sure to shower and take your morning medications prior to arriving. The admissions process can take several hours, and we want to prevent any delays in taking your medications. When you arrive at 8 Orange, the unit secretary will assist you to your room. The nursing staff will greet you and connect you to bedside monitors to record your vital signs continuously during your stay. You will have several initial tests performed, including blood work, a urine sample, and an EKG. You will have an IV started so we can give emergency medications if needed. The nursing staff will review your medication regimen with you. We ask that you bring all home medications with you in their original bottles. Some seizure medications are not carried by the hospital. We will return any medications to your family member that are not needed during the admission. If needed, these medications can be securely stored in the hospital if family is unavailable. After your initial tests are completed, an electroencephalogram test will be performed. This test is called an EEG. The technician will connect 30 electrodes to your scalp using a very strong glue. Once the electrodes are connected, a member of the epilepsy team, usually a nurse practitioner or resident, will obtain a detailed medical and seizure history. It is helpful to have a family member or friend who has witnessed your seizures available. After your admission process is completed, the epilepsy team will meet with you and come up with an admission plan. While you are in the EMU, there will be 2 cameras continuously monitoring the video and audio in the room. This data, along with your EEG monitoring and vital signs, will help the epilepsy team make their diagnosis of your events. You will likely be tapered off your seizure medications over the next few days with the goal of bringing about a seizure. Sometimes, stimulation techniques to induce seizures such as flashing lights, loud noises, hyperventilation, sleep deprivation, and use of bike pedals will also be used. Outside of testing, you'll be free to watch TV, use the Wi-Fi, and play games. You will be primarily confined to the bed or chair. Due to the risk of injury during seizures, you will not be permitted to walk in the room without staff assistance and the use of the ceiling lift sling, which will help prevent injury from a seizure outside of bed. These slings can go into the bathroom, allowing you privacy to use the facilities. Although cameras are on you 24/7 during this part of the stay, when going to the bathroom, the techs monitoring the cameras will change the angle of the camera to only show what is necessary and encourage your privacy while in the bathroom. You will not be able to shower while you have the EEG electrodes on your scalp, as this dislodges them, but heated wipes, fresh towels, and washcloths will be available for you to use. You can expect to have nursing do a neurological exam and vital signs every 4 hours. The epilepsy team will meet with you daily to review the plan of care. If you feel any symptoms like your home seizures, you and your visitors are encouraged to push your seizure button. The technicians monitoring you may also activate a seizure alarm if they see seizure-like behavior or activity on your EEG. Several nursing staff will respond to your room. Our staff are all trained to assess and assist you during a seizure event. For your safety, the bedside rails are padded, and suction and oxygen are readily available in every room. The staff will ask you to describe what you are feeling and take you through a series of questions for the epilepsy team to review. The staff will communicate with the EEG technicians through a console in the room and describe what they see until the event ends. There are strict protocols in place that are followed to maintain your safety during a seizure event. We look forward to caring for you during your EMU stay. Thank you for choosing UT Southwestern Medical Center.